So our next session is Dr. Amelia Greiner Safi, who's a professor at Cornell University in the College of Veterinary Medicine, as well as Dr. Cazer, who is an assistant professor also at Cornell in the College of Veterinary Medicine. And just so you know, if you would like further biographical information on any of our speakers, it's available in our full program agenda. But in the interest of time, I'm not going to go through all of that right now, and I will let them start their presentation.
Hi, everyone. I'm so sorry. My controls moved around on my screen, and so I was trying to unmute myself. So I'm really happy to see all of your names on the screen, even though I can't always see your faces. So I'm Amelia Greiner Safi, and I have invited my colleague, Dr. Cazer, to chat with me today about trying to think about, so we were asked to talk about how can we help a wider audience figure out how to best communicate with pet owners about, or I guess pet owners and the public more broadly about antimicrobial use in veterinary medicine and what that means for antimicrobial resistance. And so we're going to be starting kind of broad today because I'm not sure of everyone's background to kind of situate why we're talking, and then work through some examples and get into some kind of pretty specific recommendations at the end. My understanding is this audience, again, might be quite broad, so we tried to design this accordingly. So Dr. Cazer and I are going to be flipping back and forth. Casey, do you want to say anything before we get going?
No, I think I'm good.
Okay, great. All right, so for today, if I can get my slides to move here, we're going to be going over a couple of different areas. So we've split this into 5 parts and then are going to leave room for questions at the end. So first part is, again, rationale for this talk. I imagine it will build on other things that you have heard today already. And if you've attended previous sessions, build on that. But this is really going to focus on One Health. When we talk about antimicrobial resistance and antibiotic use in veterinary medicine, there's kind of 2 big branches that are worth thinking about that. And that is antibiotic use in animal agriculture, and then antibiotic use kind of outside of animal agriculture. So with pets, things like that. So I'll be touching just a little bit on the animal agricultural piece. And then we're going to be talking in much greater depth about antibiotic use and AMR, antimicrobial resistance, in companion animals. We'll dig into a case study that Dr. Cazer and I have been working on over the past couple years about how to understand why antimicrobial overuse is happening in a veterinary setting, and then we'll end with paths forward. And one of the things that I want to say at the very beginning is that, so I'm a social and behavioral scientist. Dr. Cazer is an epidemiologist. She's a veterinarian and has many other areas of expertise. And what's really neat about this project is that we've brought all of those different areas of expertise together. So I'm very interested in why people do what they do, especially in a public health context. I do a lot of work in many different domains, but One Health included. So I work on antimicrobial resistance, I work on Lyme disease, I work on fisheries, I work on cancer prevention. But what this presentation is really situated in is not only the science around the specifics of how antimicrobials work and what's happening in a veterinary context, but also human behavior and what do we need to make change. So as I'm sure is familiar for almost everybody at this point, but in case you're joining us in kind of a new way, so we're here talking about AMR because there is a horrific problem globally in terms of deaths. We're also working with many, many different audiences when we think about making advancements. So there's veterinarians, there's physicians, nurses, physician assistants, anyone with prescribing ability, pharmacists, there's labs, policymakers, those in the public health world, regulators, consumers, pet owners, right? We have a really wide array of people who intersect with antimicrobial use and antimicrobial resistance in different ways. They have varying levels of expertise, varying needs, and if we are going to make any advancements, we need to understand their context as much as possible, because that's that's how progress happens, right? Where everybody is busy and overwhelmed. People don't readily embrace change. And so if we are going to try to get change to happen, we need to be really strategic. And so that's where kind of this interdisciplinary kind of partnerships can be really promising. There's also a lot of very different understandings in what transmission pathways exist. I'll get to kind of a little bit about what the public perceives as risk around antimicrobial resistance, especially with pets. Bunch of different viewpoints on like how bad antimicrobial resistance is, whether people even know about it, the likelihood of it occurring, how severe it might be. Bunch of different views on who's responsible for preventing or managing this problem. There's really different views on what stewardship and appropriate antimicrobial use actually is. I think our previous speaker was talking about that just a bit. And then there's really varied approaches to how to effectively communicate about antimicrobial resistance. I'm going to hit on this fairly intensively at the end, or as much as I can in this span of time. One of my areas of expertise is strategic communication, and it's really about how can we match our communication to what the audience needs and what the audience understands to increase the likelihood that we'll see some kind of change. And then there's a really big need for better training, communication, and structural change. And many of these points were kind of hinted at previously. So I'm going to pass it over to Dr. Cazer for the next couple slides.
All right. So again, kind of just to set the background, probably everybody that's on this call is aware of this, but it's predicted that global antimicrobial deaths from antimicrobial resistant bacteria are going to continue going up. And this is from the Lancet study that came out in 2021 or 2024, looking at deaths that are associated with, so where antimicrobial resistant bacteria were part of the cause of death, and those directly attributable to causing a death. So you can see we're globally looking at about 5 million people a year dying because they, for one reason or another, they have an antimicrobial resistant infection, and then that's going to just keep going up and expected to be around 10 million in 2050. So that just illustrates the sort of the huge burden of this problem. And on the next slide, we'll see that the reason that we want to care about this One Health approach is because everybody is interconnected, right? Whether we give an antibiotic to a chicken or a cat or a person, we are providing an opportunity for resistant bacteria to develop and spread, and that those bacteria can then spread beyond that initial host species to other hosts. So I really enjoyed this figure from the CDC, but I felt like they kind of ignored our companion animals. So I always add them over on the right there. For many years, there's been a lot of focus on resistant bacteria and antimicrobial use in livestock. But if we think about the average person has probably more direct contact with a dog or a cat, given that over 60% of US households own a pet, than they do with a cow, a chicken, or a pig. So there are a lot of opportunities for direct and indirect transmission of resistant pathogens between our companion animals and ourselves. And we're really only just starting to scratch the surface of understanding this problem and kind of the magnitude of it.
So what I'm going to hit on now just very briefly is just a little bit about if we're thinking about kind of a systems perspective with what Dr. Cazer was just showing about how antibiotic use connects and runs through many different facets, then it's worth talking just a minute about global use of antibiotics in animal agriculture or in livestock, but then more domestically about kind of what's happening to try to work on this and what some of our surveillance systems are. In some of the work that I've done with the public, there's very little understanding that there's anybody out there kind of trying to do anything about this at all, or that anybody's paying any attention to what might be happening. And so for people who are quite new to this, I just wanted to set this up quickly. And again, Dr. Renata Ivanek will be chatting with you in the next session, and she is really the expert on what's happening in the animal agriculture world. So I am just teeing this up in the most basic way. So this is a study that came out in Nature Communication earlier this year, so in April 2025, and it is about antibiotic use quantity globally. And projections so where you kind of see the divot in the graph is where kind of the data is kind of measured versus kind of 2020 and beyond is what it's projected to be. And so I'm sharing this for a couple of reasons. One, so people can get a sense of the different creatures in which antibiotics are used in the livestock world, if this is unfamiliar. So we have pig or swine, cattle, aquaculture, sheep, goats, chickens. So if you're interested in kind of tonnage on the left, you can see it. And then on the right, it's maybe a little bit more of a clear view of kind of how antibiotic use divides out across species. So I just wanted to set the context again that if we're thinking about how transmission works and all of the different ways that people and animals can intersect when it comes to antimicrobial use, here's just a very quick snapshot of what use looks like across different animal species. This next slide is from the same paper, and there's a lot going on here, but I want to highlight kind of the global nature of this and differences between continents on use. This is not necessarily a fair representation, right? Each continent is quite different in terms of the number of animals it's working with and the different considerations. In the slide on the left, it's focusing on five regions, so Africa, Europe, North America, South America, Asia, and the Pacific. So obviously there's things being blended there. And this is about kind of total tons of antibiotics used in those regions in 2019. So this is from about 6 years ago. And again, this is just to give people some perspective on kind of what use looks like across the globe in an oversimplified snapshot, but you can see that there's different total tons of antibiotic use that there's a pretty big difference in what's happening in North America versus South America and Asia and the Pacific. A more perhaps fair representation is on the right, which is about antibiotic use intensity, and that is a measurement of milligrams of antibiotic used per kilogram of livestock. I'm not an author on this study, so for details we can dig in later. But this brings that difference down. It's showing a more accurate representation of intensity of antimicrobial use. And North America, so this would be the US and Canada, is there in the middle. But you can see that there are, again, pretty big differences in terms of intensity of antibiotic use. And again, I mention this because if we are going to tackle the issues around antimicrobial resistance, thinking about it on a global perspective is very important. A previous presenter was just talking about how pathogens don't know any boundaries. So what's happening in other parts of the world very much matters for the US. Again, I know this is a really cursory overview of this, but in case this is new, I think it's really important to kind of share that broader context. And what I'm going to bring Dr. Cazer back in for now is talking about some of the efforts that have been going on in the US over the past 20 or 15 years or so to work on reducing the total amount of antibiotics used in the United States to try to address resistance.
So I think there can be some misconceptions among the general public about how antimicrobials are used for agriculture and in food producing animals. And that's because actually a lot has changed in the last 15 years. So in 2013, the FDA implemented a guidance for industry where they brought all drugs that are given in feed or in drinking water to livestock under veterinary control. So you can't just buy those at a feed store anymore. And they also removed what are called production uses on the labels, which is where the antimicrobials were labeled for the purpose of getting livestock to gain weight faster or to use their feed more efficiently. So that really kind of changed the situation in the United States and brought it more in line with what's been going on in Europe. It also prohibited what's called extra label use of that medicated feed, meaning that if it's not written on the label, you cannot legally use it for that reason. And so by 2017, this was in place. So all the antibiotic manufacturers voluntarily complied with this regulation. And then in 2021, the FDA continued and brought all over-the-counter antimicrobials under veterinary oversight. So that included like injectable antimicrobials or oral antimicrobials that were not given in feed and water. So prior to this, you could easily find, bottles of penicillin at a pet store or a feed store that you could buy and give to your, pet chicken or your dog. And so since 2021 or 2023, when this was finished to be implemented, you can no longer buy those products over the counter. So you need a veterinary prescription, if you want any antimicrobial to give, whether it's a food producing animal or a companion animal. So this has really changed the landscape of antimicrobial use in the US in veterinary medicine.
Great. Thanks, Casey. And then kind of to conclude this section, the last piece that I wanted to bring up are surveillance efforts. So many of you may already know about this. We may have folks on the call who are part of NARMS, but NARMS is a National Antimicrobial Resistance Monitoring System for enteric bacteria. And it is a partnership amongst a number of federal organizations that are working to understand what is happening in our food supply, especially to monitor what might be happening in terms of resistant bacteria out there, and then coming up with a plan to address it. So the Centers for Disease Control is the entity that is in charge of monitoring for humans. And you can see in the chart on the right, kind of the different partners that are involved in that. So there's all health departments in all 50 states, plus the District of Columbia. They get their data from people who are sick, and then they collect data on 5 different pathogens. In terms of retail meats and seafood, and I think people often forget about seafood, and it's part of the reason that I wanted to bring in that other slide that shows aquaculture as a fairly big user of antibiotics. So there's the Center for Veterinary Medicine, and then various partners across different states and territory, and they look right now across 7 different groups of animals. So chickens, ground turkey, ground beef, pork, shrimp, tilapia, and salmon. And then you can see the list of pathogens that they look for. And then for the USDA and FDA looks at food animals. So this is, I believe, creatures before they are brought to market for meat. And they're looking at chickens, turkeys, cattle, and swine for this list of pathogens. So I wanted to, again, help people understand kind of the larger system that is in place to try to change antibiotic use habits, but then also try to keep the public safe in varying ways. So there is a surveillance system. I'm sure people may have comments on the extent to which it is working, but if people are completely new to the structure that is in place to try to keep people safe through legislation and surveillance, I wanted to make sure to share this. So this is the part that for our chapter, and again, Dr. Ivanek will get to more of this, that kind of concludes that piece of thinking about animal agriculture as one bucket under veterinary medicine and how this might relate to humans and transmission. And what we're going to move into now is really building more on why we're talking about antimicrobial resistance, pet owners, veterinarians, and companion animals. There is a lot to talk about there, and it's not necessarily well understood by the public. So Dr. Cazer and I are going to, again, go back and forth a little bit. And what I'll say before I hand it off is that, as hinted in the previous, or not hinted, stated very directly, it is antimicrobial resistance in pets is a substantial and growing problem. And Casey, I will hand it to you.
Thanks. Yeah, so this is just like a selection of some of the headlines in the last couple of years about notable outbreaks of resistant bacteria in pets that are causing a problem in the pets themselves, but also where the pets are passing those to their owners. And there, I didn't update this slide in the last year, but there have been even more. There's been a study out of Massachusetts showing that those carbapenem-resistant bacteria that Dubra was talking about can spread from animals within a veterinary hospital and then spread from those treated and sick animals to their owners, unfortunately. So on the next slide, we can look at, there's some surveillance that has been done recently at the national level in the United States using data from a very large veterinary diagnostic lab to look at resistance in what are those first-line drugs again. So as Dubra had mentioned, we have what might be called those first-line drugs, those first choices that we want to use that are probably at lower risk for causing problematic resistance. And unfortunately, the problem that we're seeing is that there is increasing proportions of bacteria that are resistant to those first-line drugs. So on the left, this is looking at amoxicillin-resistant E. coli urinary tract infections in dogs and cats. So urinary tract infections is one of the most common reasons that dogs or cats might receive an antibiotic. And amoxicillin has historically been our first-line choice. So you can see that the resistance is approaching kind of in the 30 to 40% range, particularly in the southeastern United States. And so in that situation, it could bring into question whether this is an appropriate either first line or also an empiric drug, because oftentimes we are often not doing cultures on these urinary tract infections to determine what is the best antimicrobial to use. Veterinarians are usually choosing an antimicrobial empirically based on what is most likely to work. And so if amoxicillin is not most likely to work, then we'll have to escalate to higher level drugs. And on the right-hand side, this is looking at cephalexin-resistant staph pseudointermedius skin infections. And so staph pseudointermedius is a pathogen of dog skin. It is similar to Staph aureus, how Staph aureus can be like a commensal skin pathogen in people, but then cause skin infections. That's sort of very similar. That's what staph pseudointermedius is in dogs. You can find it in many dogs, and then it causes skin infections. And cephalexin is a beta-lactam antibiotic that should be our kind of first choice for skin infections in dogs. But again, we can see resistance rates approaching 40, even 50% in some areas of the US. And so then veterinarians are going to be having to reach for higher tier drugs like third generation cephalosporins. And so we really want to make sure that we're keeping an eye on this, particularly because methicillin resistant staph pseudointermedius, very similar to MRSA, is also becoming a really large problem in treating dogs. So on the next slide, then we'll look at sort of these last resort drugs. So carbapenem resistant bacteria. This is from the same data set of this national laboratory in the United States. And the size of each dot is proportional to the number of dogs and cats that have been diagnosed with a carbapenem-resistant enterobacterales. So that's things like E. coli and Klebsiella across the United States. And I believe this was from 2018 to 2022. So there's quite a few of these infections occurring every year, and even some clusters of outbreaks that this paper was able to identify. So this is really a rising problem that we need to pay more attention to as veterinarians and as public health practitioners.
So what I'm going to share now gets into kind of the public understanding and pet owner understanding of the nature of the problem for antimicrobial resistance. And I want to say first off that this is a study from Singapore. And I know that Singapore is not the same as the United States. But what this slide does really well is characterize the kind of public perceptions about antimicrobial resistance in humans and in pets. It mirrors data from other studies that are done in the US that discuss each one of these individually, but those there's not a good study that had an easy graph or representation that I could find that addresses these same questions. So I'm just acknowledging that I'm using data from another country, but it is a good proxy for distinct studies that have happened in the US, but it's just a nice representation. So what I'm going to talk through is five different data points here. And I think the big take-home point is that people have a better understanding of antimicrobial resistance in humans, but even that is not great. And there's minimal perceived threat in terms of antimicrobial resistance in pets. So people aren't that worried about it for their pets. And they're certainly not that worried about how their pets might be impacting them in terms of the spread of disease or the impact on medicines that might be important for them in the future. And the reason that I'm bringing this up is that public perception matters a lot. What individual pet owners believe about a problem, that drives behavior, right? If you don't perceive a risk, you're not motivated to do anything differently in terms of kind of whether you've got your dog licking all over your face, even when the dog's quite sick, It doesn't motivate you to perhaps use antibiotics any differently. It doesn't motivate you to have a conversation with your veterinarian about what might be a better choice. So these understandings are really the core of any, or part of the solution of thinking about any intervention, because these are the issues that we need to respond to. So I'm going to walk you through this data. So the first question is about whether people think antibiotic resistance is an issue that could affect them or their family. And so about 70% said, yes, it is something that could affect us. And similar kind of level of response in terms about whether there are more infections that are becoming resistant. So, in some ways, I guess it's better that about 70% of people see this as an issue. That's certainly better than 30, 40, or 50%, but this is far from 100% of the population perceiving this as a problem. Okay, so those were questions about perception of the problem of antimicrobial resistance in humans. They asked the same people about, well, what do we think about pets? So it's similar questions. So antibiotic resistance in pets like cats or dogs is an issue that could affect me or my family. You see a big difference here. So this is at about 47% compared to when you're talking about antimicrobial resistance in humans, 69%. So there is a question about whether this is an issue that's worsening in pets. Again, a much, much lower response, not quite half, or just a little bit above half of the response for humans. So there's not much sense that it is, there's much less sense of risk and threat there. And then this is maybe the most concerning thing. That bacteria which are resistant to antibiotics can be spread from cats and dogs to their owners. So only 24% of the respondents, and I believe these are all pet owners because that's an inclusion criteria, thought that this could impact them, right? So this is hugely, hugely important. If the audience that is the one that is bears a huge role in the administering of medications doesn't believe there's any problem, there's, again, no motivation for conversations, no motivations for different behaviors. And this is why bringing in kind of social science and understanding the context is so, so important to thinking about interventions. And I'm going to connect this findings to some of the other work that Casey and I have done. But before I do that, I'm going to just talk a little bit about the context that happens when veterinarians try to use antibiotics more judiciously. So this means when they are making a recommendation either for a different kind of antibiotic, so one that is more appropriate for the infection, or recommending to not use an antibiotic. And there's a range of responses. And this was from a study out of, I believe, Colorado. So again, it's a single study versus a review, but is helpful to show kind of the context in which veterinarians are operating, because there can be a lot of pressure. So from this study, about 84% of the veterinarians didn't experience much pushback, right? That the pet owners, their clients, were fine with whatever recommendation they had and were willing to follow it. But that's not true in all situations. And sometimes it's, that small percent of your clients, your students, your family members, whomever, that are causing the most difficulty in terms of like your energy, your enjoyment of your job. And there's kind of two different ways that people push back against veterinarians. And one is based on the belief that, well, if we use antibiotics, that is going to relate to limiting this animal's suffering, even if the antibiotic isn't appropriate for the infection. So like this deep, deep belief that antibiotics are going to bring relief no matter what. And then the other reason that there is pushback is kind of doubt in the veterinarian's judgment, that they don't understand how sick the animal really is. But I bring this up because while veterinarians are quite trusted and esteemed individuals, just because they're advising something doesn't mean that that recommendation is always accepted. Even if people aren't pushing back in the immediate kind of the veterinary meeting, like when one's in the clinic, they may or may not be then using the antibiotics appropriately once they leave. And again, veterinarians are facing challenges from folks about their decisions about what kind of antibiotic to use and whether or not to use an antibiotic. And this is why figuring out how to communicate with those clients, figuring out how to not only talk about risk and susceptibility, but also what they can do to keep themselves safe and to keep their pet as like happy and pain-free as possible is really, really important. And so I'm going to switch to Casey again to talk about, so we've talked up to this point about there's transmission happening back and forth between humans and pets. There are issues with public understanding of the risk. Veterinarians are sometimes getting pushback for the behavior, but veterinarians also aren't always maybe doing the best thing in terms of which antimicrobials they pick. So I'm going to hand it off to Casey.
Yeah, so we can definitely do a better job. So this is data from a large network of veterinary practices in the United States. It's small animal practice where people are seeing dogs and cats. And on the left, this is showing the top antimicrobials prescribed for different types of infections. So you can see the most common infection was an upper respiratory tract infection, and the most common antimicrobial was amoxicillin clavulanic acid. That sounds like this is a fairly first-line antimicrobial. However, if we look on the second one there, which is cefovicin, or some people might say cefovicin, which is a third-generation cephalosporin. It's a long-acting injectable antimicrobial. And it is generally not recommended for actually any of the conditions on this list, but you can see it consistently ranks in the either top antimicrobial given or the second most common antimicrobial given. And so if you look on the right, these are what actually are recommended as first-line drugs for these different conditions, and cefovicin is nowhere to be seen on that list. And so this is something that we really were interested in. And honestly, my interest in it came from being out in veterinary practice and seeing how this antimicrobial was used, knowing that it wasn't our recommended first-line drug. And so we really wanted to dig more into what is going on here and why are veterinarians making this decision to use a higher tier drug when one is not needed.
Great. So we're gonna, with that, we're gonna dig into a little bit about this study that we worked on over the past couple of years about how do we think about making progress with both veterinarians and cat owners on appropriate antimicrobial use in cats. So I'll just dig into what we're gonna do. Actually, sorry, Casey, this is you.
Yeah, so just a little bit of background. So cefovicin, the brand name of that drug is Convenia. And I'll just point out actually that it just, I think, came off patent. And so there is now a generic available as well. But this, as I said, is a third generation cephalosporin. And our concern here is that third generation cephalosporins and other beta-lactams can select for what's called extended spectrum beta-lactam resistance, which we already know is a significant problem in humans, and that we see is a growing problem in animal infections as well. And ESBL resistance basically limits our available antimicrobials for treating things like urinary tract infections. So as we saw, cefovicin is one of the most common antimicrobials used in dogs and cats. In cats particularly, it is the most common antibiotic used. It accounted for 43% of all antibiotics given to cats in this large veterinary practice network in 2023. A third of cat respiratory tract infections received cefovicin, even though it's not a recommended first-line choice, and almost half of urinary tract infections received it, even though, again, it's not a recommended choice. So this is really sort of the background that set up, here's an area where we can really maybe make some interventions to try and curb what seems to be inappropriate antimicrobial use, and hopefully make better choices to preserve antimicrobial efficacy.
So what we ended up doing, this was a partnership that I think started 4 or so years ago, that had really a great team of people. So Casey and I were leading it, and we had 2 fantastic graduate students and a research coordinator. And we were really interested in understanding two different audiences, and we used different methods to understand these audiences. So first was, how do cat owners describe their success with giving oral medications? And the reason this question is important for those who are less familiar is because Convenia is an injectable, sometimes people will go to that because it's considered, convenient, way easier possibly than giving cats medication by mouth. So like via like a pill, a tablet, a syringe, something like that. We were trying to figure out, well, how difficult is it actually for pet owners to pill their cats? Are they really struggling that much, meaning that like we really do need Convenient all the time because it's impossible to pill your cat, or is there actually maybe a little bit more room there? And then we're also trying to understand from a veterinarian's perspective, why do they prescribe what they do in any number of different situations, primarily with cats? So what is influencing why they pick what they do, what formulation, in what situations do they decide to use an antibiotic, which generation, just really trying to understand their context. So with cat owners, we did surveys. With veterinarians, we did a number of interviews. So we interviewed 21 veterinarians and 600 different cat owners. And then the big question is number 3, is what gaps exist between kind of what pet owners say their practices and needs are and their habits of communication with the veterinarians versus what the veterinarians say about their decision making and how they talk about antimicrobial resistance, if they do, with their clients. And again, the idea here is if we can kind of understand this system, this ecosystem that results in different decisions about antibiotic use, then we can have some ideas on how to move forward, what information pet owners might need, what information veterinarians might need, and what structural changes might be needed to make proper antibiotic use more likely and limiting the possibility for antimicrobial resistance.
So if you own a cat, it's probably not surprising at all to you that it is actually difficult to give them oral medication, whether that's a tablet or like a capsule or even liquid. So we asked the cat owners, what kind of challenges they've had in giving oral medication, not just antibiotics, but any oral medication. And so, yeah, not surprisingly, quite a few of them reported that either they had been injured by their cat, so bitten or scratched, or that they were concerned that they would be bitten or scratched by their cat. A lot had trouble catching their cat and holding their cat in order to give it the medication. And then, of course, the medication not being swallowed by the cat. And as a cat owner myself, and I've been medicating my cat for the last couple of weeks, I agree. All of these things have happened to me. However, what we also found is that 41% of the pet owners were not able to give all the medication due to one of these challenges, yet 35% of them didn't really say anything about it to their veterinarian. So there's a really significant gap here where veterinarians are sending cat owners off with some oral medication and maybe not providing enough instruction or not providing an option to kind of check in and see how that's going and see if they can help.
So the next set of slides here are about a differing in perception about how difficult it is to give medications. So I'm gonna focus kind of. I'll walk you through this here. So the leftmost group and the middlemost group are what pet owners report about how difficult it is to give different formulations. So on the left is how difficult it is to give liquids. In the middle, it's how difficult it is to give pills. We see that pet owners report pills being slightly more difficult than giving liquids. On the right is what the veterinarians think about how difficult the pet owners find it. So it's the veterinarians we ask them, like, how difficult do you think most of your clients find it to give medications? And the point here is that based on what the pet owners say and what the veterinarians think the pet owners' experiences is, the veterinarians are overestimating by quite a bit how difficult they think their clients find it to medicate their pets. And the reason that is important is if a veterinarian thinks that their client is going to have a really difficult time medicating their pet, there could be, and we found some data of this in our interviews, that they don't even ask the client any longer about whether the client wants to give the cat medication. They go straight to the injectable. So those perceptions about how difficult it is can really matter. And if we can correct some of those perceptions that, like, yes, people may have difficulty, but it doesn't mean that they don't want to do it, that can be a really important pathway to using a more appropriate antibiotic, one that is less likely to threaten human medicine, or antibiotics available for people. Similarly, this is a little bit of the flip. It's how confident are you in giving medications? So even though it's difficult, people can still be confident that they can do it, right? Those things can exist at the same time. Like, you might have, like, it might be challenging, but you're still willing to do it and know that, like, eventually you can pill your cat. So this was useful for us. And again, kind of figuring what formulation might be easiest for pet owners, and trying if people are generally finding that liquids are easier than pills, veterinarians can work to give liquids instead of pills. And so again, here we see a pretty big difference in what pet owners had to say about their experience versus what veterinarians thought the pet owner's experience was. And so the estimation by vets was that cat owners had, like, much less confidence in their ability to give medicines. I do need to say that these pet owners were not necessarily the specific clients of the veterinarians we interviewed, so there is a limitation there. It was a different sample, but as a single study, this does give kind of an important data point that's worth exploring further, that there may be some really big differences there, and that those perceptions matter in terms of veterinarian communication with clients, veterinarians, helping clients pick a formulation that can work and is less likely to cause antimicrobial resistance, and veterinarians not immediately jumping towards Convenia or another injectable for the cat when it's not necessary. And then this is the other thing that I wanted to talk about, and this is about to what extent are veterinarians, two things. To what extent do cat owners think antimicrobial resistance is an issue at all, and the role that giving antibiotics to pets plays in that? And then to what extent are people talking about, or to what extent are veterinarians discussing this with their clients? So I guess the good news is that about 60% see some relevance for human medicine, but 81% of our participants, okay, so we had 600 participants, and 81% of them said that their veterinarian has not discussed antimicrobial resistance with them ever. So if veterinarians aren't discussing this, there's potentially really big implications. So there's why antimicrobial resistance might be important for their pet's health, and then potential transmission to people. There's maybe not any discussion of why diagnostic testing or running cultures is so important. And then there's perhaps very little discussion on antibiotic choice, and why certain antibiotics are better than others, or that no antibiotic at all is actually the most appropriate for your pet at this point, based on what we know and what they're displaying. So this kind of speaks to some of the previous data I was showing about, like, there's some awareness and some belief that this relates to impacts in human medicine, but there is, at least from our sample, and again, one study, there's not a lot of discussion between veterinarians and pet owners about antimicrobial resistance and how it relates to either their pet well-being or just safety at home in general. Then the last thing that we did, and I'll turn it back over to Casey, is we did a mini educational intervention in the survey. And so we set up a scenario that if you had just kind of, the first part of the scenario was, like, if your cat had a UTI, urinary tract infection, and you had the following medication options, and we listed the 4 different options. And I think we maybe gave a price with each of them, and they were essentially the same. So we listed cephovecin, amoxicillin tablets, amoxicillin liquid, and I'm not going to pronounce this properly.
Amoxicillin.
Thank you. Thank you, Casey. What would people pick? And with just that information, most of our participants chose, Convenia or cepofuscin. However, when we gave a little bit of information about what might lead to antibiotic resistance and what formulations and what options might be safer, or I shouldn't say safer, less problematic in terms of antimicrobial resistance, we saw this. So there was a pretty big change in terms of where amoxicillin ranked versus Convenia. And what I think is great about this is there are some people who still selected Convenia, right? That they're getting information, they're making a choice, and their situation might mean that Convenia really is the best for them. But when you're getting a little bit more information about antibiotic resistance and what that might mean for you and your pet, that is influencing pet owner decision making. Casey, did you want to add anything else about this one?
I think it just goes to show to me that I think we need to provide, as veterinarians, our clients with information. So if we're not talking about antimicrobial resistance, if we're not really providing them that context, then if you ask them, do you want me to give your cat an injection today and then you have to do nothing, or do you want to give your cat pills for a week? I think obviously everybody would pick the injection. So I think that it really comes down to that client education piece and having the time and ability and skills to have that conversation with the client.
Great, thank you. So what we're going to end on, I know we've got just a couple minutes left, are some paths forward. So the three domains we're going to talk about, so Casey's going to take the first two and I'll take the last one, is about training and norm shifts that are needed in the veterinarian space. The next is really about structural change, and this was mentioned previously in the earlier presentation. And then I'm going to end on how can we actually give useful guidance to pet owners, because we're not always doing it as well as we could when we do elect to say something.
All right. So for veterinarians, we did publish this research. It's in 2 different papers in JAVMA. And there's also an accompanying podcast, if that's your preferred method of gathering information. And so some of the recommendations that we kind of gathered from both the survey with the cat owners as well as our interviews with veterinarians is that vets just need some additional training and information, right? So thinking about what is the effect of antimicrobial resistance on pets or on people, and that sort of One Health approach. Honestly, in many veterinary curricula, there's just not a lot of time available to spend talking about antimicrobial resistance. Second, what are alternatives to antimicrobials in terms of do you need a systemic antimicrobial at all? Or how can you select between different antimicrobials to pick the best one that will minimize your risk of resistance while ensuring that you have clinical success for your patient? And then communication training and how to talk with clients. I think it was clear in our interviews that different veterinarians have different levels of comfort with having these discussions with clients in terms of dealing with client pushback or how to frame the conversation so that clients are comfortable with that plan. And then, of course, the challenge with talking with clients also comes with having enough time to do so. So in veterinary medicine, there's often a push to see more patients, spend less time with each patient. I think we see the same thing happening in human medicine. And so some of what is required is a little bit of a change in norm and basically just making more time for that conversation, whether it's with the veterinarian or a veterinary assistant or a veterinary technician. And during that time, what they can do is talk to clients about how to give the medication appropriately, including providing a demonstration and also maybe resources like videos so that the clients can go home and feel confident that they can give medication to their cats. And sort of acknowledging that this is a challenging process, right? Even for a veterinarian, it's challenging to give medication to cats, but it can be done. It can be do it safely and successfully. And so then some of the more structural change that we might need, besides that sort of appointment duration problem, is thinking about diagnostic testing. So as Dubra pointed out, it's really important that we have some sort of diagnostic test to support our decision to use an antibiotic. Now, it's not necessarily a culture, but it could be a cytology, and which can be cheaper. Unfortunately, what we found in our survey is that very few cat owners, 10 to 15%, are willing to pay for a culture susceptibility testing given current pricing, even if it helps their veterinarian pick a better antibiotic. So really we're left with cytologies, but hopefully in the future we might get lower cost or faster diagnostic tests that provide us better and more information. And then the third one would be kind of making more antimicrobial resistance data available to veterinarians. And this is something that we're also working on. If we go back to thinking about those national maps showing resistance over time, that is one of the very first studies to do that. And that kind of information is just not available. And so if veterinarians don't know that, there's higher levels of resistance in my area, then they don't know that they might need more culture and susceptibility testing or to change their antimicrobial prescribing practices.
Great. So what I'm going to end on is how to get information to pet owners that they can actually use. And one of the things that I want to highlight, it's kind of the main data point, is in the U.S., we have a pretty substantial literacy and numeracy crisis. So people can't read, about 54% of the US population can't read above a 6th grade reading level. And whatever their numeracy skills are, so in terms of skills literacy skills are, their numeracy skills are even worse. So their ability to think about numbers, proportions, ratios, any type of quantitative concept, even around dosing, is really, really limited. And what this means is that a lot of the information that is out there for pet owners about antimicrobial resistance, it's really hard to understand. It's really hard to access. It's very text heavy. If you are someone who has a lower literacy level, reading just a bunch of text is extremely hard, even if it's written in like a really simple language. So the more that we can do to make things highly visual and accessible, the better. There's lots of really well-intended efforts out there. Many scientists, many physicians, many veterinarians have never been trained on how to effectively communicate with the public. So there's no shame here, but there are things that we can do better to make sure that the public gets information, that pet owners get information that they can actually use. And so there's just a couple quick things, and I'm going to end with an example, and then we'll close for questions. So people are really busy. So whatever you're giving to people, it needs to be very, very short. If it's a video or something like that, less than 3 minutes, ideally 1 or 2. Preferably it's something that is given to people immediately. So you're not asking them to go look something up because they probably won't. But you're emailing you're emailing information to people, you're texting it to them, so it's right there on their device, or you're handing them a pamphlet. In a perfect world, it would be explained that you've got, a veterinarian, a tech walking through that information with someone. And then it's as visual as possible and as simple as possible. This isn't about dumbing it down. It's about working with our audience. I have this little visual on the side here, and it's a study that kind of found that the posters that are often up in offices they're not that helpful. The people aren't looking at them. They're not connecting in a way, and that could be in terms of design, that could be content. But when you're working with a low literacy audience, the goal is to focus on kind of like only the absolute key points. If people are really curious, there's other things out there, but people really need to understand that there's a risk to themselves and to their pets. They need to understand in a very simple way what resistance is, then how to use antibiotics, the benefits of proper use, when antibiotics not be needed, the importance of running tests on pathogens, and then what to do if a pet is sick. So this is a blend of what's called threat and efficacy. So people are having some sense of like why this might be a problem for them or their pets, and then really clear instructions on what to do. And there was a great example. It's a 2-minute video. I won't play it now because we're not going to have time, but I've got kind of the guidance here, or the link for everyone, that walks through in a beautifully visual way to explain these key points. People don't need to work through a lot of text. It's 2 minutes, or it's less than 2 minutes. It's a really fantastic example of a visual example about how to explain this to pet owners in a way that they can use. And so I just wanted to end on that note of figuring a way to translate some of this information to people in a simple, usable, visual form. There's work that's been done out there already, so you don't need to create something from scratch. Casey and I would be happy to take questions now. I know we're running short on time also, so if email is better later, we look forward to that. Thanks so much for your time and attention, and I also want to give a special thanks to Dr. Cazer for being willing to join me on this talk. So thank you, everybody, and look forward to your questions.
Thanks.
Thank you. That was a stellar presentation. I'm loving the talks today. I'm learning so much. I'm going to kick off the question and answer session then because I have a ton of questions. But I was on a call yesterday that also mentioned the, lack of owner willingness to obtain cultures on their pets due to the cost. So for the veterinarians on the call, do either of you have suggestions as to how to approach that conversation to
Yeah.
increase the willingness to obtain? I'd love to hear some of that.
So I guess my perspective on it, if you're not familiar, in 2021, this is old data now, pre-pandemic, the average cost of a culture and susceptibility was $160 in the United States. I ask this all the time when I go and do CE, and most of the audience now is saying it's over $200, and there's a not insignificant number over $300. So I don't have an answer for what we do with that. Maybe the microbiologists know how we can make it cheaper. Part of it is unfortunately markup. And so I know at our own practice here at Cornell, we've worked really hard to keep the markup on our culture and susceptibility very low so that it's more affordable. In terms of having that conversation with pet owners, I think it comes down to that you have this large outlay of cost up front. But if this is a recurrent serious infection, that's what we need in order to pick the correct antimicrobial the first time, in order to prevent them coming back again and again and again, paying for office visits and diagnostics and more drugs.
Thank you for that. And I guess kind of to piggyback a little bit, you mentioned NARMS, which does appear to focus mainly on food animals. So if resources weren't an issue, what sort of things do you think that public health could be doing to address multi-drug resistant organisms in animals, particularly in companion animals?
So I'll point out that there is some national surveillance now through the VetLearn network of pathogens in dogs, so which is really fantastic, and there's been some data coming out of that. But I think that a lot of what we don't know what we don't know, and so we need sort of that baseline information. The other big challenge is getting an unbiased sample. So NARMS, for example, is doing systematic sampling so that they have a representative view of what's going on in the food system. All of our data from dogs and cats come from owners paying for cultures. So we know that it is a biased sample, and it's most likely very skewed towards resistant pathogens, because that's, when the client comes back the second or third time with the same infection, sometimes then it's easier to get them to do the culture.
Great, thank you for that.